typical day at Mayo Clinic.
Oh, what a beautiful morning. That's...
take place in Kansas.
Well, this is from Oklahoma. You know, it's close. It's very close.
Somewhere over the rainbow there.
That's right. They could be doing a little, or Home on the Range.
It's Home on the Range. We'll just walk through a
So
typical...
1,000 new patients a day.
So we see about half of the million. And we'll admit about 200 people to the hospital, so it's a pretty big operation. This is a typical patient lobby. You can see the computer kiosks. This is all outpatients. This entire building complex. This is the outpatient coordinated care, and we do have them focused on disease-oriented groups. So there'll be a breast cancer group where you go and get your integrated care, whether it's imaging and so on. Exactly. Yeah. So it's all again patient-centered as much as we can, anticipating and meeting the needs of the patients.
Okay.
What I'm going to show you is an example of that clinical knowledge management system that we were talking about before. There's a specific algorithm that we built, a protocol around a rare condition called prolonged QT syndrome. It's a cardiac condition that's genetic in origin, related to what's called a channelopathy that leads to an increased risk of sudden cardiac death due to arrhythmias. And now it's that translation piece. We have the genetics worked out, so you can have genetic testing and predict whether or not you're going to be at high risk and have a automatic cardiac defibrillator placed and have that risk greatly reduced. But then the really exciting part is when you have a care practitioner, so the example behind you on the wall is an actual patient who has been seen by one of our nurse practitioners in follow-up for her breast cancer treatment. And she, as it turns out, she'd had a few dizzy spells, and the nurse practitioner noticed that her blood pressure was a little low and that her heart rate was low. So they did an ECG. Well, the system that we put in place, the smart system we put in place, links directly to our EKG system so that it measures the length of the QT intervals. It feeds back that information through the electronic medical record to the practitioner and gives them an alert that says you have a semi-urgent finding that you need to pay attention to. It also provides a direct link then to this program over here, Ask Mayo Expert, that gives them the essential information to say, what do I need to order next? Who are the list of experts within Mayo that I can talk to, or pick up the phone and talk to about?
But the likelihood with these symptoms that somebody would have spent weeks or months thinking it was chemotherapy related or related to
And so if I'm a neurologist and I'm seeing a patient like this and I get an alert, I now know something that I wouldn't have known, but Mayo knows. And I would have been able to take advantage of all of Mayo's knowledge on behalf of that patient.
I mean, so
this is individualized medicine.
Yeah, this is the personalized, right. So you've now engineered a lot of the individualized, personalized medicine tools into your diagnostic kits.
Correct. And this construct works for any kind of clinical information.
When we think about medical home, the way that's been described by the large medical organizations, they focus largely on what is the practice. And we've taken a different approach here. And we want to use that information then to create a new delivery system. So there's several important findings. The first one is that people really want nurturing relationships. When we asked them, what does health mean? We didn't get a definition that would match what the IOM definition is, or the World Health definition. The definition is really simple. I'm healthy if I can do all the things I need to do so that the people who depend on me are going to be okay.
Actually, that's close to World Health. It's not the absence of disease. It's living the full life you want to live. Which is kind of
so it's interesting that when we start measuring healthcare performance, we usually haven't measured that. An entirely new delivery system that's based in the community to achieve the triple aim. We're going to improve the experience of individuals with healthcare delivery. We're going to improve the population health and lower the cost, all at the same time. So in 2 weeks, we're going to be meeting with community leaders in Austin to share with them the results of this research and our goals and to get their engagement.
So for the Beacon Award, it's involving care for asthmatic children and diabetics, so adult diabetics and asthmatic children, so really a spectrum of chronic diseases.
Can you stop 1 second?
Yeah.
Do you all know what what they did for the criteria for Beacon Awards in terms of, well, it wasn't only looking at communities, health centers, whatever, that had a health IT system in place, but it was using those systems to drive a higher quality level of care. That's really the lens through which these awards were given. So Mayo chose asthma and diabetes as two of the focus areas. But I know you all will take it seriously, but the term Beacon was chosen carefully because we really do want these 15 projects to be
The beacon.
bright lights and have people. So part of this is how to share this on a real-time, ongoing basis.